Hi, this is Dr. Schwartz, and today we're going to talk about minimizing your risk of developing breast cancer or having the cancer come back once you've been diagnosed with breast cancer. That's called breast cancer recurrence. Now, there are certain things that increase your risk of developing breast cancer. The use of hormone replacement therapy in women that undergo menopause is known to increase your risk of developing breast cancer. On the other hand, birth control pills for the longest time have been debated as to whether they increase your breast cancer risk. The latest data suggests that birth control pills do not increase your risk of developing breast cancer. Surprisingly, we also found out that in early childbirth, having your first child before the age of 35 reduces your risk of breast cancer by more than 34% compared to women who have their first child after the age of 35. Early menopause also reduces your risk of breast cancer. Women who undergo menopause before the age of 44 have a significantly reduced risk of breast cancer compared to women who undergo menopause after that age. In addition, we know that obesity contributes significantly to your risk of breast cancer recurrence and developing breast cancer. We know that regular exercise also reduces your risk of breast cancer recurrence or developing breast cancer. Excessive alcohol intake has also been associated with breast cancer recurrence risk. It's also thought that this increases your risk of developing breast cancer. For women who have a history of radiation therapy, usually for lymphoma, we know these women are significantly increased for their risk of breast cancer in the future, and they need to be monitored very closely. Surprisingly, most breast cancers are not familial or they're not inherited. 90% of breast cancers have nothing to do with your family history. 10% of breast cancers are inherited, but the overwhelming majority of women who develop breast cancer, it has nothing to do with their family history. Now, stress and environmental chemicals are unclear with regards to their contribution to breast cancer recurrence and risk, and these are studies undergoing to determine whether these factors contribute to a woman's risk of developing breast cancer. Now, what can you do to definitively prevent you from getting breast cancer? For women who are high risk for having breast cancer based on family history or an inherited genetic mutation, they can undergo bilateral prophylactic surgery, which means removing both of their breasts to reduce their risk of breast cancer by more than 95%. For women who choose not to have surgery, they can choose to take a medicine, typically an anti-hormonal agent, tamoxifen or an aromatase inhibitor, to reduce the risk of breast cancer by more than 50%. Thank you for watching. If you like this video, don't forget to subscribe and hit the notification button.